it's pretty much time. We'll let anybody else in as they come along. So I'll call the meeting to order. And looks like it's our pretty much our regular band of happy people. So first off, I've got birthdays. Jerry Bellinger will have a birthday on October 23. And as I mentioned last week, our club anniversaries were Peter Cook and Keith Dawson, both at 28 years. And I'll have a fresh supply next week for whomever else is coming along. We'll open up with happy thoughts, and then I'll have some club news to share with you. So anybody with a happy thought that we want to get presented?
Am I on? It's Andy Watson. Am I on? Can you hear me?
Yeah, we'll go Andy and then we'll go Karen.
Okay, because I've lost the picture. Well, I'm happy today. I got a happy thought because yesterday I had the cataract surgery on my right eye and everything is just fine. I just have to take it easy for a day or two. So that's wonderful.
So no driving for a little bit, Andy?
Well, I don't know.
we
don't drive
depends
very
on how well you can see right
now.
now.
Don't drive very much anyway. You gotta go to the dump on Saturday morning. That's
well, by then you should be fine.
Yeah, you'll be all better by then. Yeah.
Yeah, I mean, don't get in the way of the dump.
Okay.
Karen Kirk-Dwight. Whoops, I got you muted.
Nuts. Forget
There we
that
go.
all the time. I think everybody knows that yesterday was Tampon Tuesday, and I volunteered in the afternoon to help collect product from folks that were doing the drive-through at the Chatham-Kent Nonprofit Center. And I have to tell you that I think that process of doing something differently has really paid off. The training room was absolutely filled with product at the end of the day. And, you know, we kept the doors open until 6:30. So the people that were getting off work at 5 o'clock would have time to get there. But it was a steady stream of cars that went through that one-way drive through yesterday. And they weren't just dropping off one product, they were dropping off bags of product. So it'll be interesting to see how many products we collected this year, but from the looks of things, it looked like it was a whole lot more than last year. So
That's
great effort.
Karen, is it too late today?
No, it's never too late. There will be, you know, at least 13 different recipient organizations that will benefit from the donations. So, and they're going to be needed all year round. So
where's that again? You deliver?
It's the United Way office, the
Okay.
Chatham-Kent Nonprofit Center, next to the church on McNaughton.
Ours is on the stairs
I mean,
upstairs.
at the United Way office is good.
Yeah.
Yeah, okay.
And about $1,000 a week funds coming in currently for our Rotary Bingo, which is a significant step up. Hopefully that'll help. So yeah, with regard to bingo, hats off to everybody that is able to help out with the bingo. It is keeping us in, or helping to give us a really good shape right at the moment. So to everybody, there's so many people that participate in it. We just thank everybody. We need it. It's going to help make things a little easier for us than what other clubs may have. Any other happy notes before I get into some club news? Alysson?
Not a happy note, Brett, but I was wondering from Peter, how is Abdulio and everyone who had COVID that you talked about last week?
Abdulio seems to be fine, and his family is fine. My Spanish teacher is getting better very slowly. I mean, it was several weeks of oxygen after her 45 days of hospital. And the young woman who works in Lusani Contreras' house, I guess is doing okay. She's young, and the family, nobody in the family ended up getting COVID. So everything is so far okay. I have having weekly meetings with Lusani, organizational meetings for the Payten project. So I'll hear more this Thursday.
Thanks, Peter.
But thanks, Alysson, for asking.
Moving on to club news, everybody knows next week is our Pizza for Polio event. So Alysson and her team have done a great job getting several pizza vendors to jump on. We were a little bit slower this year than in previous years without Keith spearheading us. So thank you so much to Alysson for picking that up and getting that going. Alysson, how many vendors in total?
We've got 8. So that's pretty
8.
good, actually. Yeah.
8 around Chatham is good, and I've already had people telling me, oh, this one's good and that one's good, and so I don't think we'll have a bad one going. So
No.
thanks very much to those vendors.
Is there any such thing as bad pizza?
I don't think
Is that
so.
possible?
But,
Even
no.
bad pizza is pretty good.
Right. With regard to that, we'll continue to pop out as many updates. If you receive them, share them. We'll try and get as many pizzas ordered next Wednesday as we can. We did on bingo last night. I had the information from Tilbury and Ridgetown. They are both making their event on World Polio Day on October 24. And I think Tilbury has a couple pizzerias there. Out in Wheatley, they've got actually 3 out in Wheatley. Surprised me. And they have one in Merlin. And then interesting in Ridgetown, since the president of Ridgetown is Ben Pinnell, he's the baker in town. So it's Donuts for Polio. So they will run their event on October 24, and I'm sure a donut or a pizza, anything will be good. You could do one for dessert. What the heck? The other thing I wanted to mention is I'd sent out an email with regard to the gift, and I was reminded that I was slightly politically incorrect. It's for the holiday season, not for Christmas, the holiday season. So it is being designed so that any other group, Muslim or whatever, anybody needs help, we want to help them for sure. And that will now make sure anything I do on that will be the holiday season. If you are interested in helping out with that, you can go to thegiftck.com and register. And at the bottom of the registering, if you can put a note in there that you'd be part of the Chatham Rotary team, and send a message to both Tony Hill and myself so that we can keep abreast of who we got volunteering. And then Tony has agreed to be our captain. So Captain Rotary, thank you very much, Tony, for stepping into that. And there's many things to take place between now and that time. And I think not this Thursday, but the next Thursday is kind of an open meeting. So we'll have anybody that is wanting to know more information will be able to step into a Zoom meeting next Thursday, a week from tomorrow. The other thing to mention, sometimes we have to be a little bit flexible and make some adjustments. And had the situation where Ann Arbor Rotary Club has been able, in the last couple of weeks, they've been able to confirm that Jennifer Jones will be speaking to their club, which happens to take place exactly the same time as our club meeting. So I was a little anxious about asking our speaker, Gary Sabota from the WASH, is it the WASH program, Peter? And ask him to move out, but he more than graciously has agreed that he would step aside so that next week we can sign into, we have to go and register. I'll be sending out the information on this. Have to go and register to get into the Ann Arbor meeting. And then we will be able to join the Ann Arbor meeting next week to hear Jennifer Jones. So I think any of us like that opportunity, knowing the speaker in advance. So our meeting will not take place. We'll be hooking into that one, but you have to register, and then you'll be clicking in on their Zoom, however they get that out to us.
Brett, there's a link to the registration on the district website as well. If you
Okay.
just Google 6380 Rotary, you'll get the district website. And right near the top, you just click on the picture of Jennifer Jones and it'll take you to the registration.
Okay, make it nice and easy. That's what we like.
And Brett, I've already registered for that, and I went in through the Ann Arbor Club.
Okay, and Jennifer and Tony, I think, have done so this morning as well. So
We did it through Sparky's invitation.
on the Facebook.
No, Sparky emailed everybody with the invitation again.
Perfect.
So-
Okay.
Yeah.
The other thing I wanted to mention, for many years now, Lynn and I have kind of just kept an eye on this radon gas thing. The Chatham-Kent Public Health Unit is going to make available a radon gas detector. That is, the last time we did it, it was something we put in the basement, and you left it there for about 3 months, and then you sent it into a lab. When you send it into the lab, then you have to pay a lab fee, but they'll send back a notice as to how your house is as far as radon gas. And our primary reason is Jack Pearson. He started working from home and in the basement, and then came up with lung cancer, and unfortunately did not last too long. So, it's something, if the municipality has this available to us through public health, you have to go onto their website, register to get one of the units. I believe there's about 100 units or more. Let's call it 100. So you get registered, then you can go and pick it up between certain dates. But if you go to the Chatham-Kent Public Health website, you'll be able to get details on that. So just like to keep everybody as safe as we can.
Mhm.
Hello, Tanya. Hello, Diane.
Hello.
Alysson, I'm just trying to set you up so that you could maybe do.
Can I just add one thing, Brett,
Yes.
to what you just said? Sorry.
Yeah.
I just actually saw on Twitter that all those units are claimed.
Oh, are they?
They
Okay.
were very popular, which is a good sign. So unfortunately, Public Health does not have any more. But I think they have a link suggesting where you could buy them.
Okay. And the
yeah.
cost of them is not that much. I think the bigger cost is in sending it into the lab.
Yeah, still a good idea to get one, even if you can't get one for free, for sure.
Okay. So Alysson, let me go in through security. I think I have to do something. So if you have anything with your presentation to share screen. Okay, that should work now. So this is our polio meeting before World Polio Day. And Alysson has been able to put a few things together for us. Polio is just one of those things that we keep an eye on always as part of Rotary. As everybody knows, we're this close, but it's like, wow, there's two countries that we just cannot get a handle on. I think what makes me quite happy is Nigeria was, I believe it was in August, finally declared polio free. And when I was at the conference in Hamburg, Lynn and I happened to sit beside two people from one of the clubs there. And, they were quite excited to, in a couple of months, they were going to be considered polio free. And that was a huge thing for them. So Alysson, if you can, and if we need to do anything to fix things up, we'll definitely try and help you along.
Okay, let's see here. So I'm no Keith Koch, but I will do my best to give you a quick update about polio. Can you see that? Is that coming up?
Yeah, if you,
Okay.
yeah,
Oops.
the green one there, I think.
Yes, there we go. Okay. So I'm just going to give you a quick update on where we're at with polio, and then I'm going to talk a little bit about a few other items that affect polio. I'm going to talk about COVID and polio, and then we're going to watch a video near the end that's about 5.5 minutes long, and then we're going to go from there. So that should be enough to fill a decent meeting.
Perfect.
And I have what I'm saying on the screen, just because I know some folks are visual more than auditory. So I'm going to do both to make that easier for everybody. So as we all know, Rotary's been working to eradicate polio for more than 35 years. And our goal is to rid the world of this disease. And we are closer than ever to doing that, which is great. Now, is this presentation going so far? I can see my two screens, but is it okay, Brett?
Yeah, yeah, we're
Okay,
good.
great. And as you also know, probably, if you've been in Rotary for a while, that we are part of the Global Polio Eradication Initiative, and we've reduced cases by 99.9% since our first project in the Philippines in 1979. So we really are this close. And we've contributed $2.1 billion, and really, I don't think they've even tried to count the volunteer hours. I think it would be literally in the trillions. It would probably be almost impossible to categorize how many hours we've spent to protect 3 billion children in 122 countries. And Rotary as an advocacy group has also done very well because our efforts there, not only just with the actual act of vaccination, but we have advocated governments to contribute more than $10 billion as well. So it's not just our vaccination efforts on the ground, it's also working with governments and convincing them to contribute to the effort. So that's a big part of it. Now, as Brett mentioned, Africa is in a good place, but we have two countries where it's been very stubborn, Afghanistan and Pakistan. I'm going to talk about that shortly, about why that is, because I think it's something we need to know about. But it's crucial to continue to work to keep other countries polio free, because we're not in the clear just because we don't have polio in other places. And polio is like COVID in a way, is if we stopped eradication efforts today, we would have more cases almost immediately. And with Rotary's estimates, if we stop polio eradication today, within 10 years, we could have 200,000 children paralyzed by polio. So we need to keep our efforts up, even though we obviously have other global pandemics that we're addressing. Polio is something we have to keep our eye on the ball with that. So right now, as of 2020, or 2017 for the dollar amount, but it costs about $3. And this is US, this was on the Rotary website, so this is US dollars, so it's a little more Canadian. But the average cost to fully protect a child against polio, so that's still a very low amount. In 2017, which was the latest year they had data, was $430 million it cost to vaccinate kids in 39 countries, which is pretty amazing. And it costs annually about $100 million every year to conduct polio surveillance, which means keeping an eye on places where polio has been recently eradicated, but we need to make sure it doesn't come back. As we stand today, or actually last week, because the Global Polio Eradication Initiative is about a week or two delayed into how they report their numbers. So as of last week, we have 52 cases of the wild polio virus, 1 in Afghanistan. And last year we only had 29. So that's a pretty big jump, which is a bit concerning. But in Pakistan is actually better so far. They have 77 cases this year, and they had 147 last year. So that's an improvement, which is very good. And as Brett mentioned, on August 25th, the World Health Organization announced that transmission of the wild polio virus has been officially stopped in all 47 countries in Africa, which is really a remarkable achievement. And that's after literally decades of hard-won gains in that region. Rotary and our partners in the GPEI, and just in case you aren't aware of who's in that, that's the World Health Organizations, it's the CDC in the US, it's UNICEF, which I don't think I realized UNICEF was part of that, but that's important. The Bill and Melinda Gates Foundation, as I think we all know that, because they've been a major financial supporter, and also Gavi, which is a vaccine alliance, which is one we'll probably hear more about as the COVID vaccine progresses. And we all work together to achieve this milestone in public health. So that's a great sign about the different partners who work together to make this happen. So the last cases in Africa, in the African region, were recorded in Nigeria's northern state of Borno in August 2016, after 2 years with no cases, because it does take, there's a timeline that you need to follow to officially declare a country polio free. So there was challenges in Nigeria. They've had some civil conflict there, and also with reaching mobile populations to hamper efforts to immunize children there. So it's great to have them sorted. And that, how do you certify a place that's certified? And that's basically when you have the Independent Africa Regional Certification Commission, and they conduct thorough field verifications that confirm no new cases, and they analyze polio surveillance, immunization records, and the lab capacity. So it's actually really, really important to make sure that that area of the country, or the continent, I should say, is addressed. So now that the African region is free of the wild polio virus, 5 of the 6 WHO regions are representing more than 90% of the population are now free of the disease. So good news there. And as we said, it's still in Afghanistan and Pakistan, which is in the WHO's Mediterranean region. And as you know, we have helped build extensive polio infrastructure that has been used to respond to COVID-19. And in 2014, also Ebola, as well as yellow fever and the bird flu. So what the infrastructure that we've set up for polio is really going to help us tackle other global or regional health issues. So there's so much important work being done there that I think needs to be recognized, that once polio is gone, we can use all of that to address other health issues, which we're using for COVID-19. So sooner than we realized. Can you hear that? Okay. Give me one moment. So I'm working from home and living with my parents because my husband is teaching. So my mom is on her bridge game and I am on my presentation. So I apologize. That's why I was wearing my headphones. I thought I would be able to filter out some of the background noise. So I apologize for that. I'm almost done. So we're getting close. So here we go. So as you may not know, this is something that I find very interesting and very concerning, and that one of the main reasons why we've had trouble eradicating this in Afghanistan and in Pakistan is because of the US government. And this is because when the US was trying to find Osama bin Laden, they actually used a fake polio vaccination program to track him down. And this is actually common knowledge now, which wasn't at the time, but more information has been come out. So it's very concerning because this has set back our polio eradication efforts substantially. And we're still feeling the effects of that, as I will show. So in 2019, just last year, there were staged videos about polio vaccinations that went viral on social media, on Twitter and Facebook, that became an engine for vaccine misinformation and mistrust in Pakistan and derailed the efforts to immunize millions of children. So these videos, I've seen a few of them, they're terrible. They falsely reported children falling gravely ill after receiving the polio vaccine. And in the hours that followed this video going out, 25,000 children were taken to hospital by their, oh, I have a little spelling error there, by their terrified parents in the city of Peshawar alone, believing their children had been poisoned by the polio vaccine. And by the end of the week, at least 45,000 kids were taken to hospital by terrified parents who thought their kids had been poisoned by polio, the polio vaccine. So this is where, and I raise this because we have an issue now with social media and COVID-19, for example, because there's a lot of misinformation that gets shared on social media. And this is how this thing can go like wildfire and have very serious health consequences. So as a result of these fake videos, the immunization campaigns were suspended. People got very confused. No one wanted to get vaccinated, and health facilities were actually burned to the ground because of these anti-polio videos. 2 police officers and 1 female health worker actually were killed in this frenzy. And thankfully, most of the original videos have been taken down, but re-uploads are still viewable and shareable today. So we have to be very cognizant of this kind of misinformation, because Pakistan was on track to successfully immunize almost 40 million kids before these videos went viral, and they had to suspend their vaccination campaign. And since then, 2 million children have gone unvaccinated. So that's a real-time effect of online propaganda. So very concerning, and something that's still ongoing. So I wanted to just raise that because I feel like that's an issue that Rotary being, and this is my own personal opinion, I will say that, but Rotary is based in the US, and this is not something they have addressed, that their own government has been at fault for creating these challenges. And I think using polio volunteers for a CIA target is, to me, quite frankly, unforgivable. But anyway, that's my own little soapbox. So routine, anyways, back to where we stand now. To get Africa, we must have the routine immunizations to make sure that the wild polio virus does not return, and to keep kids protected from the circulating vaccine-derived polio virus, which is rare, but does continue to infect people in parts of the African region. And that is true, that sometimes when you get the polio vaccination, you can become infected from polio. It's rare, but it does happen. So we have to keep these high quality campaigns going, especially during COVID-19. We have to keep kids vaccinated against polio while also protecting workers from COVID-19 to make sure they don't contribute to COVID-19 transmissions. You can just imagine the extra layer of complexity that we're facing with the global pandemic to try and continue vaccination. So it's really more important than ever. Yeah, I don't want to hold everybody up. So why don't I send this video to everyone in a link? It's 5 minutes long. I don't want to keep everyone too long, but I apologize for that. I thought it was automatic, but I'll send this to everybody, and that way you can watch it on your own time. It's 5 minutes. It's worth 5 minutes of your time because it really does. It explains how COVID-19 will be positively, in terms of the vaccination process, positively impacted by our polio infrastructure. So I'm going to stop. I'm going to share my other screen now. Just come back to my PowerPoint.
Oh, shoot. I've come up with a picture now, and I think
okay. So that is where we are. So we'll have that. So these are the folks who are participating this next Wednesday, October 28th. Konstantino's, Andy's Place, Boston Pizza, Mike's Place, Original 2 Pizza, Pie-Zano's, Pizza Tonite, and Steve's Pizzeria. So that's 8 great pizzerias and restaurants who are joining us this year, which is wonderful. Thanks to Tanya and Denise and Tony and Brett for all your help distributing posters and getting those out to folks. I appreciate that very much. And this year, it's not just benefiting polio, it's benefiting these local businesses because they're really struggling this year. So it's very important to have that extra bonus. If you can remember, and if you don't mind, to take a photo while you're there ordering if you go in to get your pizza or if you get it delivered, whatever works. But any extra promo we can give to folks would be great, because we really want to thank them for their support this year. And then after that, we'll go around after the 28th, we'll go around and collect their donations, and I will let you know what we end up with our total. And we'll ship that over to the polio fund.
Great.
So that is where we are at today. I apologize for that technical glitch. And I can email, or Brett, you can email the list of pizzerias and the link, whatever is most convenient.
Yeah, I'll be sending that out probably a couple of times between now and even next Wednesday morning, so we can set up whatever we're ordering for lunch or for dinner.
Yes. Now that I have donuts I've got to eat, I got to plan my menu for that day.
Konstantino has chicken wings as well, so
oh, well, there you go. Perfect.
it's all good. Alysson, can you stop the share screen there for a minute?
Oh, yes, sure.
And then, so our illustrious panel here, we're going to ask if there's any questions, but I do have one to begin with. I know Keith and Marty Koch had gone someplace and delivered the vaccine, I believe, to kids. Do any of our members know where they had done that? Rick knows, and we know how much Rick is. Hang on, Rick.
Can you type it in the chat, Rick?
We got no volume from you, Rick, or no thing. Karen Kirkwood, you know?
Wasn't it India?
Rick, was it India?
The general consensus is it's India. Yeah, I think it was.
In my mind, just to think of the places like Afghanistan and Pakistan and the workers that would go in there, I know I've seen a few different shots of other people that have gone to India. And I mean, when you think of the size of India, the number of kids and that kind of thing, just amazing. And you know, our own polio warrior, Keith, went to the front lines and helped deliver that. So, you know, it just says something about the gentleman for sure, and the family as well. So Alison, thank you very much for the presentation. I'm afraid it's the type of thing that next year we'll kind of be looking for about the same thing.
I'll start, if I start working on
lower. Oh, Egypt.
Okay, there you go.
I got that. So thank you, Rick.
We can still do low tech, even though it's high tech.
Oh yeah, it's we learn to deal with it and roll with the punches. So definitely be an interesting event going into probably some of the more back areas in India as well.
And Brett, if I could add, just thank you, Alysson, and everyone for support. I know polio would have a huge impact on our kids and our community and our treatment center if you know, got any traction in the future, and so it's really quite a miracle, and definitely well regarded and appreciated, and just thank you.
Great. Thank you. Just trying to do something here. Okay, so Barry Fraser, you have some.
I'm going to reflect back. I did this someplace else earlier in the week. So back in 87, 88, when the polio campaign started within our club, and this was, of course, Keith was president of the club in 86, 87, and I 87, 88. It was in those 2 years, overlapped a bit, that within our club, we raised $125,000 American to kick off our club's support to the worldwide polio campaign. It was truly amazing at that time, and our club got a lot of recognition out of that from the district and beyond for those that weren't around at that time.
Well, and Alison, go ahead, please.
Sorry, that's it. Thank you, Barry. I don't think I mentioned, which is a fairly crucial point, that our club over the years, since its inception, has raised $250,000 for polio. So our club alone. So that's a very important piece that I included in our media release to the media, but I forgot to include it in this presentation. Yeah, our club alone has raised $250,000 over this campaign. So that's really impressive. So way to go, everybody.
And there was something published not too long ago about our district is still #1 in, is that polio or was that something else?
That was polio, yeah, for last year. Our district was the highest in the 3 big zones, which I think is all of North America and most of Central America as well. They've changed the zone districts, but it's a very big area, so something to be very, very proud of, yeah.
Well, and I think what the board, I believe we're looking at is once we see what comes in from our Pizza for Polio event, we'll definitely be topping that up and adding money to it to send into RI for the polio campaign. So that'll be forthcoming. And once we know how we do, then we'll get our decision made as to what we add to that and forward that in as well. Any other questions for Alison? We'll put her on the spot if we can. No, I think we're good. So thank you very much, Alison. Definitely, we know there are glitches that happen, and we're all learning and trying to get a little bit further. Hang on, I got to plug in or I'm going to die here.
I may have it figured out by my presentation in 2021, Brett. So if I start working now, I might figure out the audio by then. That'll be my goal.
We do have time for sure. So just a reminder, I'll be sending out something to everybody to make sure they get registered with Ann Arbor for our meeting next week. And the meeting next week will not be our regular Zoom, but it's going to be Ann Arbor Zoom, and guest speaker to be Jennifer Jones. So please make sure you follow through, because I know everybody about next Wednesday about 11:30 are going to be looking for my message as to how to sign into our Zoom, and then I'll be getting the emails that what happened. So please do that. Julia, if you would please. Thank you, Julia. Thank you, Alison. Thanks everybody for attending. And we will see you in the neighborhood.